Hello everyone, and thank you very much for joining us today, Thursday, August the 20th, for our press briefing where we will provide an update of the situation on COVID-19 in the WHO European region. My name is Luba Negro. I'm part of the media team at WHO Europe. We welcome all journalists who are watching us on Zoom, but also everyone who is following us on Facebook and Twitter. Before we start, just a note for journalists who want to ask questions in this second part of the briefing, please connect to Zoom. We will be able to take questions on Zoom only. So now without further delay, let me introduce our panel. Today we have, as always, with us Dr. Hans Kluge, WHO Regional Director for Europe, and Dr. Catherine Smallwood, Senior Emergency Office at WHO Europe. Dr. Kluge will start with a brief opening statement, and then we will take your questions. So, Dr. Kluge, the floor is yours.
Good morning and welcome after a very busy summer. The European region has registered 3.9 million cases, corresponding to 17% of the global total that is approaching 22 million cases. The epicenter of the pandemic is now in the Americas, but other regions are also seeing a steep rise in cases. The European region is on a trajectory of its own, showing a different trend compared to the rest of the world. The virus hit Europe early and hard, and countries made phenomenal efforts to stop the spread by locking down schools and non-essential businesses as part of a comprehensive set of measures. And it worked. Between May and July, many countries managed to suppress transmission. Where policy decisions were prompt and responsive, the response was effective. But the virus has been merciless, where there was partisanship, disinformation and denial. The risk of resurgence has never been far away. In the last 2 months, new cases have been steadily increasing every week in the region. There were 40,000 more cases in the first week of August compared to the first week of June, when cases were at their lowest. Every day now, the European region reports an average of over 26,000 new COVID-19 cases. And this is due in part to the relaxation of public health and social measures, where authorities have been easing some of the restrictions and people have been dropping their guard. The good news is that now we know much more about the transmissions of this virus, and in particularly how it is spread indoors in poorly ventilated settings, and especially where large numbers of people are coming together and speaking loudly or singing. The challenge is that localized outbreaks and clusters are now occurring with greater frequency, often in closed settings such as workplaces and care homes, or linked to specific events, social gatherings, communities, food production and other industrial facilities and travel. Recent outbreaks among vulnerable groups such as migrants and refugees illustrate how we cannot leave anyone behind. This virus increases inequalities. As summer turns to autumn, what challenges lie ahead? We must make sure that we adopt the right public health measures to enable the safe return to school, manage the approaching influenza season, sustain our economies, and address the increased health risks to older people at this time of the year. The COVID-19 pandemic has created the largest disruption of education systems in history, affecting nearly 1.6 billion learners in more than 190 countries, and our region is no exception. Most countries in the region closed schools at some point between February and July this year, as part of the COVID-19 related public health and social measures. The WHO European Regional Office is convening a virtual meeting for all 53 countries on reopening of schools and COVID-19 on the 31st of August, where concrete actions will be discussed to ensure children receive proper education in safe settings. Such options might include heightened hygiene and physical distancing in school settings for all, the introduction of targeted measures quickly and effectively to suit local circumstances, open schools where virus levels are low, adjust school schedules and limit pupil numbers where cases are more widespread, and consider keeping schools closed temporarily in areas where community transmission is high. I am very grateful to the Minister of Health of Italy, Roberto Speranza, for being the catalyst for this conference. The next influenza season is also approaching fast. Now it is critical that countries monitor flu activity and restore and reinforce routine surveillance to include both viruses, and that they promote flu vaccination for at-risk groups. This is even more important this year, as we need to protect our hospitals and health workforce, already having to cope with COVID-19 from being overwhelmed. This year, even more than previous years, we must support older people to get their flu jab early in a safe environment. But we are not in February. We can manage the virus differently now than we did when COVID-19 first emerged. Already in the past months, 2/3 of the countries in the region have reintroduced restrictions on mass gatherings, weekend curfews and or closure of certain non-essential businesses. What is different is that many of these recent restrictions have been implemented locally, showing that we are learning how to apply smart, time-limited and risk-based measures, capable of reducing both the spread of COVID-19 and its impact on the wider society and economy. Today, with increased knowledge and experience, we also know that some measures require nationwide and sustained implementation, including the extensive testing and isolation of all cases, the tracing, quarantining and 14-day follow-up of contacts. With the basic nationwide and additional targeted measures, we are in a much better position to stamp out these localized virus flare-ups. We can manage the virus and keep the economy running and an education system in operation. We can save lives and livelihoods. It is not a matter of one or the other. Young people are at the forefront of the COVID-19 response, and they have a very powerful message to convey through their behavior and their communication. To the teenagers, adolescents, my daughters everywhere, to all of you at that exciting, adventurous point in your lives, thank you for the sacrifices you have made to protect yourselves and others from COVID-19. No youngster wants to miss a summer, but I'm very concerned that more and more young people are counted among reported cases. According to a recent study, globally among those aged 15 to 24, cases of COVID-19 have increased from a rate of 4.5% at the end of February to 15% in mid-July. Low risk does not mean no risk. No one is invincible. And if you do not die from COVID, it may stick with your body like a tornado with a long tail. While young people are less likely to die than older people, they can still be very seriously affected. This virus affects organs throughout the body, but especially the lungs and heart, with some young and fit people, including elite athletes, suffering considerably. Youth, like everyone, have to play their part to limit the opportunity for the virus to spread by wearing a mask in situations when you'll be interacting closely with other people to protect them from getting infected. Avoiding crowds and large groups, staying away from crowded bars and big parties, by meeting outdoors rather than inside if possible. And whenever meeting in small groups, keep at least 1 meter apart. And always, always wash your hands, and with any signs of symptoms, stay at home and seek testing. Finally, to repeat my key messages. 1. We are not back in February. We know how to target the virus. Instead of targeting society, we became smarter. 2. To the younger members of society, spread fun, but do not spread the virus. Protect your parents and grandparents. 3. When we open society, we have to open the schools. Thank you.
Thank you very much, Dr. Kluge. Now we can open the floor for questions, and we will take one question per person as usual on the first round, and then if the time allows, we'll have a second round of questioning. So, dear journalists, please remember to unmute your mic and introduce yourself and your media outlet before you ask the question. I can see we have an extended list of journalists online. I'm very happy to see you all, guys. And a number of raised hands. We have TV from Bosnia, Radio France International, we have daily records and so on. So I will start with the first raised hand. Tom Magner from Carers World Radio, I suppose, right? I cannot see the full line of your
Sorry,
outlet name, but I suppose that's it.
That's correct, yes. So, carersworldradio.com, we cover social care issues. A question, if I may, specifically about care homes. It's been brought to our attention that government inspectors going into care homes are instructed to wear PPE, but they don't have to have a COVID-19 test before they go in. Our viewers think there could potentially be carriers of the disease between care homes. So what's the WHO's best advice? Is it test before, test negative, or it's just not important enough to test before these care inspectors go in?
Yes, thank you very much, Tom. So I would suggest this question for Dr. Smallwood.
Good morning, Tom, and great to have you back, and thanks for the question. Absolutely. So we're very concerned about long-term care settings. As well known, these have been locations where we've had a perfect storm of factors that have contributed to the acceleration of the spread of the virus within those settings and in communities. And movement of people in and out of long-term care settings such as nursing homes is of course something that we need to be very cautious about. Now, in terms of WHO's position on testing, our position is very clear. We still have a position that countries and systems should be testing all suspect cases, i.e. people who correspond to a case definition that is on WHO's website and has been recently revised and updated. In terms of the specific care settings in different countries, these are managed in different ways. In some countries you have staff that go from different home to home, and there should be very specific, context-specific precautions that are undertaken. The use of PPE, of course, is one extremely useful protective measure that needs to be accompanied with other training and guidance to those staff that are moving between different settings. But in terms of whether they're tested, that really depends on the policies and the availability of testing capacity in place at that country level, that first and foremost all suspect cases have access to testing, and then other groups may be prioritized, such as healthcare workers, on that basis.
Thank you very much, Dr. Smallwood. Now I give the floor to Esmir Milovic from N1 television station in Bosnia and Herzegovina. Esmir, can you hear us? Can you
Yes,
unmute?
I can hear you. Can you hear me?
Yes, very well. Go ahead.
Good morning. My question is regarding the region of Western Balkans. In the past few weeks, we are seeing a rise of numbers. Croatia, Bosnia, and Serbia are recording mid-200s numbers over the last few weeks, and those are record numbers for us here. And we are seeing a lot of younger people, as Dr. Kluge have said. So my question is, what is WHO Europe view on the situation in the Western Balkans, and do you have any recommendations for the region how to deal with this surge at the moment of the virus? Thank you.
Thank you very much, Ismir. Actually, I would suggest this question. Actually, I would suggest this question to go to Dr. Kluge. But if Dr. Small would have anything to add, has anything to add on the data and evidence part, please do. Dr. Kluge.
Thank you very much, Ismir, and your point is spot on. So in essence, it comes back to what I was mentioning, that the response has been very effective in those places where there are measures being implemented prompt and decisive, which comes back to the core of the public health strategy to really beef up the testing capacity, tracking, tracing, isolating, treating with care. But the responsibility is on both shoulders. The leadership has really to be very proactive, including with risk communication. Risk communication has to be clear and consistent and instill public trust. And there is then the responsibility also on all of the citizens. We are seeing in several countries a kind of emergency fatigue. In that sense, the WHO Regional Office for Europe is working with the countries on studying the reasons of that fatigue through behavioral and cultural insights, and then we are ready to assist the countries adapting their approaches. Here, in particular, because you mentioned the Balkans, I would like to express appreciation to the European Commission, because we are joining forces to beef up our technical and policy assistance through the Directorate of the Neighbourhood to particularly assist the Western Balkans, and I myself, I have regular telephone conferences with the Minister of Health of all those countries. Thank you.
Thank you. And just to add, indeed, the situation in the Western Balkans has been a concern of ours since early June, when we started to see cases increase, and it's been very much a sort of sub-regional hotspot over the summer period. What's encouraging is that as we've been working very closely with each of the member states that have been seeing these increases in cases, and we've been working specifically along the lines of the regional directors' comments, we're now starting to see in several of those countries a levelling off and signs of an early decline now in some of those countries. We will still need to work a lot harder to keep this decline going. As many have said, given the opportunity and given the conditions, the virus will spread. We are all susceptible still, or not all of us, but most of us are still susceptible to this infection, and we really need communities to take this on board, take the adequate steps both at the country level in terms of the basic contact tracing, case identification and isolation, and testing systems that need to be in place, and then where there are hotspots and increased transmission, additional targeted measures need to be brought in place very quickly to nip transmission in the bud, stop it from spreading, and keep the level of transmission at controllable levels. Thank you.
Thank you very much. Now I would like to give the floor to a couple of people who actually took their time to contact us in advance with questions, and thank you very much for doing that. So the first one is Kyoishi Sasazawa from the Oyumuri Shimbun. I'm very sorry, Kyoishi, if I don't pronounce it correctly. It's the one of the leading national Japanese national newspapers. We've got 3 questions from him, and I will take the first one, and then if we have additional rounds of questions, I'll add more, Kyoishi. So the first question is the following. How, when, and from who did WHO Europe obtain information on the earliest sign of unknown pneumonia clusters in Wuhan, China, at the beginning of the outbreak? And I would direct this question to Dr. Smallwood.
Thank you for the question, and I would certainly point as a point to start off with the timeline that WHO has published on the COVID-19 response, and that indicates at the corporate level within WHO how we were first notified and became aware of this, and that was of course on the 31st of December 2019, where our country office in China was able to pick up information from the Wuhan Health Commission. What we have in WHO is a very strong network of teams that all focus on what we call event-based surveillance or health information. And between these teams, we share on a daily basis any information that's relevant to global health security and any information that may constitute public health risk of international concern. So immediately on that day, our regional office here in Copenhagen that covers the 53 member states of Europe were informed through our regional office in the Western Pacific of this information. And we, at the same time, were able to share this information with colleagues and partners in the European region, including the European Centres for Disease Prevention and Control. As days followed, and as more information came to WHO, we very promptly shared the information of a novel coronavirus in the early days of January, and the European office undertook daily meetings and daily information sharing through our networks and with our member states to ensure that any new information was shared. And this was very much the early days of our response.
Thanks a lot, Dr. Smallwood. And then I see on the list Lucy Ho from the European branch of the CGTN. Lucy, can you hear us? I don't have your question. You contacted us before, but I don't have your question. Can you ask it now?
Yeah, Lucy Hoff on behalf of CGTN. You mentioned there you're concerned that young people are now primarily responsible for rising infection levels in Europe. Do you think there's been a failure of national governments to communicate that message specifically to young people? And how concerned are you about an impact of schools reopening in September on those rates amongst young people?
Thank you very much, Lucy. Some of the aspects have been covered in Dr. Kluge's opening statement, but I hope he has something to add on that, or to stress some main messages from that, in that area. Sorry.
Yes. Let's say that we have been all learning iteratively, meaning step-by-step approach. So now there is a number of studies which are contributing to the body of evidence that indeed children and younger people are playing a part in the transmission. But still, as I was mentioning, it is much more limited than in the adult population and the elderly population. But that can have, now that we see more and more infections in younger people, different reasons. I mean, one obviously is if there's relaxation of the restrictive measures. There is another element of more testing and also more recording. But going back to your question of the schools, that's exactly the reason why we have been working over the summer with experts to put together a set of policy options for our member states on a safe and gradual reopening of the schools, but also of the academic year. And that conference will take place the 31st of August. The schools are not a stand-alone environment. I think that's a key issue, right? It's not a biotope on itself. So it depends very much on what is the level of transmission in the community. The key issue there is, are we concerned? Yes, we are concerned, but we are as much or sometimes more concerned about what we have seen when the schools were closed, that we left quite some people, including people, for example, with special learning needs, right, behind. And in that sense, the key issue is a risk management approach, that there has to be a very good assessment what's happening in the communities, and then to be very quickly to localize it and contain any outbreak quickly, decisively and locally, like many countries in the WHO European region have been able to do so.
Okay, thank you very much. Dr. Smallwood wants to add a few details. Please go ahead, Dr. Smallwood.
Thank you. And I just would like to add that, yes, we have seen an increase in the proportion of younger people being COVID cases over the past few months. That much is clear. And I think when we think about that, we need to untangle a little bit the drivers of that. And there are several things that may be contributing to this. Risk perceptions, of course, behaviors, the fact that older age groups are continuing to shield, and this is an important thing, so they may be removing themselves from the chains of transmission, which the younger populations are not. But we also have continuous improvements, and I think this is a positive sign, in our testing strategies across Europe. And so it means that we're picking up a broader proportion of the cases that are actually occurring. And that means we may be seeing a truer age distribution of the cases. And we did see this in some countries like Germany that always had a very broad testing strategy. And so there are several things that are contributing to the numbers that we're talking about here. And it's important to recognize the complexity of that.
Thanks a lot for covering that extensively. Now we have Jeremy Lange online, and I think, Jeremy, it's Radio France Internationale.
That's it, yes. Good morning. My question has already been asked, but I would add maybe another one regarding this reopening of schools. In France, pediatricians launched an appeal asking for better testing for children and the use of saliva testing. I was wondering if you have any comment on that. Do you think that the children going back to school should be widely tested through this new saliva test? Thanks.
Thank you, Jeremy. Catherine, okay, Dr. Smallwood will answer this question.
Thank you, Jeremy. I think there are two very different components to your question. One is about schools and children going back to school, and the other component is about more widespread testing and mass testing. And this is something that we're following very closely, and we're engaged in the discussions around testing strategies. So on the first, our current guidance remains, and as I said earlier, that testing should be focused on suspect cases, and those are largely cases that are symptomatic. As we know, children tend to have presentation of the disease at the milder end of the spectrum, which is good news, but where children have symptoms, WHO's recommendation is that they are tested. The second component to that is on saliva tests, and it's welcome news that there are additional medical products and testing technologies that are coming online that are less invasive. And of course, for children in particular, the use of nasopharyngeal or oropharyngeal sampling is pretty invasive and maybe more difficult. So we certainly would look at the saliva tests as they come online as something that would be useful in continuing molecular testing and targeting it on suspect cases. But as I said, opening schools is something that's very hot on the agenda now. As the regional director said, it really needs to be taken in the overall context of those communities at the local level. Schools, we do know that there has been transmission of COVID-19 at schools, but COVID-19 is also transmitted at the workplace, in homes, in the communities, in social gatherings. So this is what we need to look at as a whole.
Dr. Smallwood, can I add one aspect about masks in school? Because we, in the media team, we're getting quite a lot of media queries on that. Is there anything WHO can say on that? Wearing masks at school?
WHO and UNICEF are actually working together at the moment to issue some new guidance around the use of masks in children, and this will be available soon.
Thank you very much. So now we're going to the back to the list. We have Sam Meredith from CNBC. Sam, can you hear us?
Yeah, I can. Can you hear me?
Very well. Go ahead.
Yeah, thank you. Good morning. I'd like to ask about concerns over the seasonality of the coronavirus, please. I wanted to ask what your assessment of the risk that the transmission of COVID-19 is likely to be more intense over the winter months in Europe. And also, what is your view on Europe's current state of preparedness for such a scenario? Thank you.
Thank you very much, Sam. I think, again, we have a situation where we will need the input from both our panelists on preparedness. Probably Dr. Kluge can say something. And Catherine, do you want to start?
I can do. Thank you for the question, Sam. It's something. Winter is coming, and we're certainly looking at the risks that are associated with that. And even before winter, we're seeing in the European region, at least, this worrying trend at the moment, with increased cases being reported from a large number of the countries across the region. So we need to think about the winter months, but we also need to think about before the winter months in the autumn. And now, as people are traveling more, they're going back to work, schools are reopening. These are all factors that are going to increase the risk of community transmission and further transmission. Now, as we approach the flu season and the winter months, there are additional factors that will conflate and add even more to that level of risk. So that includes the traditional months where respiratory viruses tend to circulate more easily, and that's certainly because of the cold, and it's because of people congregating inside more in more crowded settings. So we are very concerned that countries prepare adequately for that, and we're very, very engaged in that at the moment, and I'm sure the regional director will say something about the work that we are doing here in the European office.
Thank you, Katie. So in a nutshell, the key issue is that the virus has not gone away. In several countries where we saw a decrease, it was not because of the natural course of the virus, but due and thanks to the restrictive measures, which means the virus is still active in our societies. Having said that, we are not in February, where at that time almost everyone was caught off guard, and that the default option was to shut down the societies and then to reboot. In that sense, we know now how to target the virus. At the same time, WHO, together with the Global Alliance on the Vaccines, Gavi, and many partners, are relentlessly accelerating the work on coordinating the development and manufacturing of vaccines. But having said that, even a vaccine will not be the end of the pandemic. The end of the pandemic will be the day when every one of us will take the responsibility and have been learning how to behave with the virus. And that depends on us. That day can even be tomorrow.
Thank you very much, both of you. Now we have Naobet Biceno from Bloomberg. Naobet, can you hear us?
Hi. Hi there. Yeah, I can hear you. Can you hear me?
Very well. Please ask your question.
Okay. I would like to know your assessment of the COVID situation in Kazakhstan, because we had really bad situation here in May when first lockdown was eased, and in July we had a total collapse of healthcare system. So after the first lockdown, I need to give you some background. In Kazakhstan, they registered over 250,000 pneumonia cases, which government claimed wasn't related to COVID, and I think around 5,000 deaths. But when China said that warned its citizens from living or traveling in Kazakhstan, that in Kazakhstan there is outbreak of deadlier than COVID pneumonia, this like dual or double statistic Kazakhstan, and the government then said, okay, in consultation with the World Health Organization, from 1st August, we will combine statistics of COVID and pneumonia. At the same time, they said all these 250,000 pneumonia cases from March, from 1st January till 17th of July, I think, they wouldn't count in the statistics. And now for 20 days, they are still counting pneumonia cases, COVID-like pneumonia cases separately from COVID. And they tell journalists to combine them manually yourselves with a calculator. I would like to know your opinion. What do you think of this situation when Kazakh authorities are trying to run 3 sets of statistics: COVID positive, COVID negative, plus COVID-like pneumonia? And do you think they are not, reproduction number is correct when they don't include about 250,000 pneumonia case and deaths from pneumonia? And what do you think of this? Sorry.
Thank you very much, Albert. Thank you for a very comprehensive questions. Actually, there are so many aspects that I will aspects of this question that I will have to ask again our panel to comment both of them. So first we'll start with the statistic. If Dr. Smallwood can say something on that, and then we'll go on Kazakhstan's cooperation to Dr. Kluge.
So let me start with the bigger picture indeed. So from the 1st of August, Kazakhstan in fact made a change in the reporting, which follows rigorously the WHO guidance to include cases which are clinically compatible with COVID-19 but not laboratory confirmed, which explains the increase and also increase in COVID-19 like pneumonia, but COVID negative. And in fact, I would like to commend Kazakhstan for this bold move. Other countries have been doing this in the past, for example, Spain, that then at that moment you saw a peak, and then from that moment the situation can again be compared. In fact, next week I have a video conference with Dr. Alexei Vladimirovich Tsoi, the Minister of Health of Kazakhstan, on this and other matters. But we have been very encouraged by Kazakhstan following those WHO reporting. And then for the details I will pass to Dr. Smallwood.
Yes, thank you, RG. And indeed, we do expect and we commend countries for reviewing their data and looking at how they're classifying cases, and if they need to do so, to take changes. We work very closely with countries, including Kazakhstan, on these types of issues, and when we understand very well the reasons for those changes, we're able to actively commend those countries for doing so, and explain why we're seeing differences in the cases that are being reported and why there are potentially peaks that may not really reflect an increase, a real increase in cases. It's simply that a reporting artifact. So as the regional director said, we've been working with Kazakhstan and other countries in looking at the reasons behind pneumonias that have not necessarily been classified as COVID-19. We're confident now that Kazakhstan has been able to adopt a new reporting mechanism that allows them to use the international classification of diseases to classify pneumonias appropriately. At the same time, we've been supporting at the technical level, and we've had some laboratory experts in Kazakhstan working with the laboratories both at the central level and at the national level to look at their capacities and see how any kinks in their systems at the laboratory level can be ironed out. And this is something that we're working hand in hand with the Kazakh authorities and laboratories to undertake. We'll also be working to internationally confirm some of the samples collected in Kazakhstan in an international reference laboratory. This is something we do regularly, and we encourage countries, particularly countries that may be having some issues with their laboratory systems or their reporting or seeing unknown pneumonias. And we encourage countries to be providing samples for international confirmatory testing in the laboratories that have been identified by WHO as COVID-19 reference laboratories.
Okay, I hope all clear for you. And now we have Sweden online and Svenska Dagbladet, Gunilla von Hall. Gunilla?
Yes, can you hear me?
Very well.
Okay, thank you very much for taking my question. Look, I'm based in Switzerland, in Geneva, and I have a question concerning a study that came earlier in the week from Zurich, from the EPFZ, and the study showed that asymptomatic patients or persons could be contagious up to 5 days before they actually get ill. I'd like to know what you think about this, how significant this is, and would this in any way change the advice you give? Should one, start to trace people back 5 days, which seems quite difficult and ambitious? Thank you.
Okay, thank you very much, Gunilla. It's a technical question, so it's for Dr. Smallwood. Catherine, go ahead.
Thank you, Gunilla, and it's a good question. So first of all, we're following all of the studies that are presenting information on how the disease transmits, when it transmits, and how well. And you mentioned one of these studies. There are many studies that are occurring, and at our corporate level, we look at these studies together and interpret the data across different research papers, and we look at the evidence as a whole. When talking about asymptomatic, or in the case that you mentioned, pre-symptomatic patients, so patients that have not yet gone on to develop signs or symptoms of the disease, but may carry the virus and be infectious, we do know that this can happen. And WHO's current guidance is for contacts of cases that their exposures should be investigated up to 2 days, i.e. 48 hours, prior to the onset of symptoms of the case to which they have been in contact with. We're looking at the evidence. We're eager to learn any new information as it occurs, and we will be adjusting our guidance if it's needed. And that is based on a comprehensive undertaking and systematic review of the evidence as it's presented to us. So thank you for the question.
Thanks a lot. And now we have Associated Press UK health correspondent Maria Cheng. Maria, very glad to see you on the list. Can you hear us? Please ask your question.
Hi.
Can you hear us?
I can. Can you hear me okay? Hello?
Yes, we can hear you.
Okay, great. Thank you very much for taking my question. So my question is about the Russia vaccine that was approved last week. WHO said at the time that they were waiting for more information about this. So I'm wondering, have you received more data from Russia? And could you tell us what that information is? And I guess related to that, do you have any concerns about the widespread use of this vaccine that hasn't gone through the phase 3 trials? Are you concerned that it hasn't passed through the requisite scientific requirements and that it's being widely used despite the information only being available on a few dozen people?
Thank you, Maria. I'm looking at the panelists and I see that actually both of them, they want to comment. Dr. Smallwood, do you want to start or we? Okay, go ahead.
Let me say overall that any advances in the vaccine development is very encouraging news, right? And the Russian Federation has a long tradition of vaccine development and uptake. If we think at the yellow fever vaccine and then the polio vaccine domestically, so that's very welcome news. But as you rightly say so, every vaccine has to go the same rigorous standards on efficacy and safety, and ultimately to know there's only one way to do so, it's clinical trials, phase 1, phase 2 and phase 3, including phase 3, which speaks about a much larger audience to which the vaccine is administered to really see whether it is particularly whether it is safe. And WHO indeed is being invited to review thoroughly the data. If there's any details, I'm happy to pass to Dr. Smallwood.
Nothing too much to add. Just to re-emphasize that this concern that we have around safety and efficacy is not specifically for the Russian vaccine. It's for all of the vaccines that are under development. We're taking an accelerated approach, and it's absolutely essential that we don't cut corners in safety or efficacy. So it's a central concern for all of the vaccines. In terms of the information that we've received from Russia on the vaccine over the past 10 days, couple of weeks, we've entered into direct discussions with the teams, and our pre-qualification colleagues have been sharing the various steps and information that's going to be required for WHO to take assessments, and this process is ongoing, and we'll surely update everybody wants a process of reviewing all of the information, but we're not going through a rush job of trying to jump to conclusions here. We want to take our time to really understand where the vaccine's at and to get as full information as possible on the steps that have already been taken.
Thank you. Moving on, and we have Vivienne Aitken from Daily Records. Vivienne, I can see your raised hand. Can you hear us? Please ask your question. Please unmute.
Hello?
Yes?
Hello, can you hear me? I'm sorry, I'm having internet problems this morning, so apologies if these points have already been raised. I want to take you back to schools and starting back of children into schools full time. Scottish children are already back at school now, and we have seen pupils from senior school and from primary school having the virus now. I heard what you said earlier on about masks, and you're still discussing with UNICEF about the use of masks in schools, but do you think that teachers should be wearing masks to protect children? And also, do you think there should be social distancing in primary schools? It's generally accepted that under 11s don't pick up the virus as much, but there is a growing number of children with it. So should we be social distancing our young people as well? Thank you.
Sorry. Yeah, I forgot to unmute my phone, my mic. So now I'm on. Vivian, thank you very much for joining us despite your internet problem. So what we will do, because we already covered that question, we'll just go to the second part of the question, and then if after that you still have any questions, just keep in touch by email with us, and we will provide you with details. So about the, Dr. Small, do you want to add anything about the masks in school and so on? Thank you.
Yes, I can. It's very difficult to state very specific recommendations, and that's partly because our approach is very much around risk management and an undertaking of a risk assessment, and that can be done for each school. And there are some general considerations. WHO has already published these earlier this year, and there will be more specific advice provided in the following weeks around what measures could be implemented. Certainly, physical distancing in schools is a part of that. There's a package of things that we have outlined, and physical distancing in schools, gradual return of classes, smaller class sizes, potentially even in some contexts outdoor teaching to reduce the level of risk are all things that can be considered. What needs to be undertaken is a systematic assessment at the community level to understand what the situation epidemiologically in that community is, and then look at steps that can be taken to reduce the level of risk in school settings as well as in other settings. In terms of mask wearing by teachers, it's a very good question, and certainly something that needs to be considered as part of this. So questions, for example, what is the level of transmission that the school is located in? If there's community transmission of the virus, if there's very little possibility for teachers to be social distancing, then yes, this should be considered as a possibility to reduce the potential of teachers transmitting inside the school setting, both between teachers, but also from teachers to children. So all of these are valid. They need to be taken into account and need to be assessed in a systematic way. And it's that process of risk assessment that's the most important.
Okay, I cannot see any hands raised on the list, but so I can return now, as promised, to the second questions from Japan. Mr. Sasazawa questions, and I will read it as provided. Reportedly, SARS-CoV-2 mutates at a certain period of time, in other words, relatively quickly. So far, did you find evidence or signs that the virus has become less virulent in Europe due to mutation accumulation? As it's a technical question, Dr. Smold, I have to address it to you. Go ahead.
Thank you, Luba, and thank you very much for the question. I think this was raised also in recent media briefings with our headquarters colleagues, and we're aware of a number of virology papers and research that are ongoing around the possible mutations of the COVID-19 SARS-CoV-2 virus and the impact of those on the disease itself and how the disease presents. At the moment and to date, we've not seen significant major changes in the way the disease is presenting in populations. However, we're following mutations very closely, and we're aware of the papers that have recently been issued around the D614G strain. At headquarters level, we're putting together a group of coronavirus experts to look at the mutations, to track them, and to provide some interpretation into these. But it's important to note that at the moment, the papers and the research that have come out have really been pointing at the virological aspects. What we need to look at as well is really at the clinical level and in the presentations, and this is what will be followed very closely to make sure that as the virus mutates, which is absolutely normal for viruses to do, that we track those and that we are able to interpret those mutations and understand whether they are actually causing changes in the disease or not.
Okay, and now I see that we have some time left just probably for one more questions, and I'm looking. Tom Magder is raising the hands again from KRS World Radio. Tom, go ahead.
Yes, thank you. Thank you very much for the rare opportunity of the second question. I was very interested, Dr. Kluge, in what you were saying about your definition of the end of the pandemic. And as I understood what you were saying, it's that when people accept that it's there and behave accordingly. That's not a medical assessment. So how should we as journalists report as the COVID-19 pandemic continues to try to address this type of definition?
Yes. Tom, can you please clarify a little bit what exactly your question is? Just to be sure when we answer it, once again.
Sure, thank you. Yes, my question is that all of the reporting that we and my sort of international colleagues do is about this as a pandemic medically. And so all comments arise out of the medical situation. But what I thought I heard this morning was more of a human acceptance, more of not a medical, more a psychological approach. Am I right about that? And if not, can you please clarify what you said earlier?
So medical versus humanitarian and psychological approach.
Yes, thank you. That's brilliant. Cheers.
Great point, Tom. So I would like to link this to a major initiative which I have announced last week, which is the Monti Commission. So I have established the Pan-European Commission on Health and Sustainable Development, which is going to be chaired by Professor Mario Monti, previous Prime Minister of Italy, previous European Union Commissioner, and currently the President of the Bocconi University. The first meeting will happen next week, Wednesday, the 26th of August, with about 16 high-level commissioners, which are former heads of state and government, life scientists, and economists, civil society, linked to your point, not purely medical. And what the Commission is going to do is to reflect on how did society change since the COVID, and what does it mean for the resilience and the investments in health and social care systems. So it's pan-European, and it's to strengthen our health and social care systems. But to give you one example, there will be a commissioner on culture and arts. We know of the impact of arts on well-being. The cultural sector has been completely shut down during the lockdown, with quite some impact also on the society. And this goes for mental health, for economy, for education, etc. So this will be a time-limited commission. The report should be there in September of next year. There will be about 5 meetings, but after each meeting, we will have a press brief and update you. In fact, next week, the press conference that I will be giving will be exactly on the first meeting of the Monti Commission, which may shed some light on what you are telling, because it's really whole of societal and not only medical, particularly, that we will have to live with it. But what is clear is no health, then no economy, and huge impact on all other sectors. And that's what the Commission is aiming at, to position health at the top of the political agenda for economic development and social cohesion. Thank you.
Thank you very much, Dr. Kluge. And on this high note, let me close this press briefing, and thank you all for joining us today. Very quick note before we close. We will, as usual, we will publish the video of this presser and Dr. Kluge's statements on the WHO European website very soon. It will take us a couple of hours to work, so bear with us. Those who need it sooner, please contact the statement sooner, please contact us by email. The addresses are provided in the invitation. So thank you once again, and goodbye. Bye-bye.